Dr. Raja Amarnath. So he comes from the background of MD in Pulmonology, followed by DM in Critical Care. He holds his European Diploma in Intensive Care from the UK and is a Fellow in Royal College of Physicians from Edinburgh. He is the Managing Director of CIPACA, an organization that specializes in drop-in ICU concept, working on a mission to establish standardized tertiary level ICUs at every single taluk in the country by partnering with rural hospitals and thus bringing the life-saving emergency and ICU services within the reach to the rural Indians. Widely acclaimed as India's leading rural ICU care provider, CIPACA is a team of ICU expert doctors, ICU nurses, ICU technicians, paramedical professionals, ICU patient counselors, infection control teams, multidisciplinary critical care teams, ICU software and IT professionals, and administration professionals committed to deliver 24/7 world-class ICU care services to the small and medium hospitals located in taluks, districts, and suburbs of cities. It is currently operating across 7 states of the country. Under his able leadership, CIPACA has achieved ICU quality care in rural hospitals on par with international standards with a survival rate of more than 94%, serving patients with less than one-fourth of the cost of the city hospitals. CIPACA has received several awards and accolades at national and international levels. To name a few, they received Best Innovative Healthcare Delivery Organization at the Indo-Arab Health Summit in Dubai, Best Quality ICU Services in Rural India by the International Healthcare Pride Awards, New Delhi 2020, Best COVID ICU Care Provider in Rural India by the National Health Awards, New Delhi 2020, the most socially responsible organization at the Asian African Leadership Forum in the year 2021, and recently they even received the most trusted multidisciplinary ICU care provider at the International Healthcare Leadership Awards. Dr. Raja envisions to empower the rural India and wishes to do so by strengthening the healthcare pillar of the rural and remotest part of the country. Thus, he has embarked on yet another journey of empowering rural hospitals to grow 10 times with their new organization, CIPACA Business Concepts. May I request Dr. Raja Amarnath, Managing Director of CIPACA Business Concepts, to share his insights.
A very good evening to one and all. I must sincerely thank Mr. Prakash and Mr. Anand who have first of all told me what MSME is. I am a doctor, odd man out in this community. See, doctors, they don't talk much about business, right? In our community, it is forbidden. Because if you put an advertisement saying I do good treatment, and MCI will ban me. So we are, bound by Hippocrates' oath that I will not promote myself. But that's what everybody sticks to, at least most of the doctors, especially in rural areas, which also works as the advantage for corporates, where they do all the required publicity and marketing and take advantage of branding as the better or the best treatment facilities available. India has, I don't need to say, 130 plus crores population. I don't know the current statistics, but we are definitely growing faster in that. It is said that we will beat China in this number, soon. And you all might be knowing that 70% of our population, they reside in rural areas, which means 80 crore people approximately, they live in rural areas, and their health and their lives, it depends on rural hospitals. So much has been spoken about MSME, and first time I am hearing, sir, I am so sorry, your organization, I am not aware of it so far. 40,000 hospitals are there in India, in rural communities, who are serving these 70 crore people. I don't think even 10% of them are aware of what MSME is. Because when I travel, length and breadth of the country to talk to rural hospitals, because we are in the mission. I don't call it as a business. We are in the mission of setting up ICUs in rural hospitals. I don't need to say what is the requirement there, because any patient in rural area, which is a village or a taluk area, if they have to go to ICU, a standardized ICU, you know very well that only metropolitan cities they have, that too in corporate hospital they have ICUs. To travel from this place to that place takes 1 to 2 hours time. In emergency, every minute counts. Patient may reach there through our existing ambulance services, and the patient may survive, but every minute delay actually adds on to the recovery. So the delayed recovery in a corporate hospital adds on to the pocket of the biting the pocket of the patient. So why should someone spend lakhs of rupees for 3-4 days of ICU care, which would save the patient? With that objective in mind, we started creating ICUs in rural hospitals to show the world that you can provide the international quality of standards of ICU care in rural areas. It is quite possible. That's what we have been doing across 7 states now, and with an appreciation and a recognition as the best rural ICU care provider so far. But when we meet people in rural hospitals, the owners, either they are absolutely non-medical people, somebody maybe from real estate background, or somebody with some vision, some pain in their past, saying that my mother died of cancer, so I want a hospital, like that. Or most of the times, 90% of the times, it is the doctor who is from that son of the soil, from that place, who has gone to city, studied, and came back and started a hospital. You all know, no? They actually build the hospital business brick by brick. Doctor sees OPD, outpatients, from morning 8 o'clock to night 11 o'clock. In between he sees some inpatients. 1 or 2 emergencies he refers out. And when he sees that I am getting enough number of patients, he starts some 10 beds in the hospital. Like that they grow. If you see their history, 20 years they move to 20 to 30 beds. It's okay. I mean, they are doing their part. But because they think that I am unable to serve some certain disciplines, certain higher level of care, and when they say I am unable to provide this service, and they tell their public to go, it actually adds to the fall of economy of that rural areas. Just imagine, one taluk, you take any of your place, one taluk surrounded by 20-30 villages, covering approximately 3 to 4 lakhs of population. Every day, at least 10 patients will be moving from that place to nearby city for care, which is actually at least 1 to 2 lakhs more expenditure for each person. So 10 lakhs per day multiplied by 1 month, you just calculate. That is a loss of economy in those rural areas, just because the rural hospitals in that place are unable to provide the required services. I am not saying that they can immediately become transplant centers, but if they are providing 25% of service today, and in city hospitals providing 100, even if you move them from 25% to 50 or 75% is enough to save the economy of those rural areas, also preserve the economy of those rural hospitals. With this objective in mind, we today launched an organization called CIPACA Business Concepts. I'm really privileged and blessed to do this on this MSME day, because my fellow men, our colleague doctors who are in business, they don't even call themselves as entrepreneurs, because they'll be working like employees only, from morning 8 o'clock to 11 o'clock as doctors. For them, some sort of teaching is required, some business knowledge is required, some vision is required, and basic financial discipline is required. They should know what is available, at least with respect to the support, like what the great dignitaries just now told. Doctor will be sitting in his room, only those who approach him, he thinks that is the world in rural hospitals. So that education is required, hand holding is required, guidance is required. Support is required in clinical areas, nursing area, administrative area, funding, financials, and also in business development areas. So with this is what is 360 degree for rural hospitals. And believe me, if you support a rural hospital, it is not just for that hospital, it's actually for that community. So every single person, the rural people in that community will get benefited because of it. So this is the first day of our birth of this organization, and people like you, sir, we need your help to support us, to take this to the masses and the rural hospitals, and see what best we can do to uplift them, to grow with an objective of, to make them grow 10 times, which means the benefit for the rural population will be 10 times. Thank you so much for the opportunity.